So thank you so much, everyone. Good evening to all of you. My name is Nidhi, and I am the host for your session today. I am the founder of Silver Talkies, a community-led platform for older adult people above the age 55. And most of the people that I've been conversing with today, when you joined in, are all members of the Silver Talkies Club. It's our social networking club exclusively for the 55 plus. And the idea behind the club is how do we kind of create opportunities for our members to network, to be socially connected, to find new friends, and also do a lot of fun, entertaining, and learning activities together. So, as part of our club activities, we host sessions like these that you're attending today. Sometimes we keep them open to guests so that, especially when it's around awareness and awareness building and information. So, we do invite guests also many a time. So, thank you so much for joining us. But other than these kind of awareness sessions, we also have a lot of other fun and entertainment sessions that we have during the month. So, in a given month, we have about 8 to 10 sessions across different topics. For example, we had an Antakshari session earlier this month. We had a session called Cafe Guftagu where we talk about life after retirement. Mala is hosting a session for us next week called Travel from Home series, where she would be taking us on her trip with her to Namibia. She recently visited there, not Namibia, sorry. She went to Masai Mara and Kenya. So she is going to be sharing about that trip. We also had a session very recently on wellness in golden years, which was by Dr. Swami Nathan. So the idea is how do you kind of keep yourself informed? How do you kind of keep yourself busy? And we also have meetups and group travel that we do. So our Bangalore chapter is meeting on the 19th, Chennai chapter is meeting on the 26th. So every month, our city chapters have a in-person gathering as well in their respective cities where they get to meet each other and do fun stuff together. So that's about the Silver Talkies Club. And if you would like to know more, you can see the name of the website on your screens. And you can also write to us at connect@silvertalkies.com. Now, moving on to today's session, we have a very special guest. These are our new partners, an organization called ALYVCare. And joining me today are its co-founders, Anudeep Nagalia and Bala.
Good evening, everyone. This is Anudeep. Firstly, thanks to Niti for giving us this opportunity to come and talk on this session today at Silver Talkies Club. Maybe we'll start with a very quick introduction. So, Bala and me, we are based out of Bangalore. We both come with like 15 plus years of experience, and we are already running a e-commerce startup in sports and fitness called CHRA.fit. This is a second startup. We both had personal experiences where we stay away from our parents. They stay in a different city and we stay separately. And there are a lot of times when we are a little concerned about how they are doing, what can we do for their well-being. And that is where this idea was born. Our idea is about how we can take care of ourselves by doing some basic things like starting with a preventive health check, which a lot of times we do only reactively. So our idea is, why do we have to wait for something to happen? Why don't we start something beforehand? So idea is to do something preventive. Second thing was start monitoring things on everything about us on a regular basis. Now technology is there where we can monitor each and everything on a very regular basis on an online basis. And third is do basic activities which could be related to fitness or nutrition, which can actually help you in terms of increasing your lifespan, delaying the problems, delaying the diseases. And that is the whole idea which was born. So today we want to talk about a little bit how about the problems kind of come in, what are the key factors. And we have Dr. Nishmitha, who's a consultant geriatrician, and she practices at a Sparsh hospital. Right. Dr. Nishmitha, you can kind of start.
Yeah. Hello. Good evening, everyone. Thank you for having us today. And it's really nice to see so many of you in a meeting. So before we start, I'm Dr. Nishmitha. I'm a physician and a geriatrician. So I have done my MD medicine and post that done a postgraduate diploma in geriatric medicine. Okay. So geriatrics is a relatively newer branch of medicine which specializes into the care of older people. Now, the physician or the internal medicine consultants, usually we approach disease as a reactive perspective. From we sort out whatever problems arise. But as geriatricians, we are also trained to look at certain problems in a proactive way and then address them appropriately so that we can tackle things before they become a bigger issue. Now, aging starts silently in the 50s and 60s. So, small unnoticed changes which happen from day to day slowly turn into bigger health risks later. So, there are decades to act if we want to stay independent, active, and sharp well into our 70s, 80s, and beyond. So we don't just have to address problems on a reactive basis, we have to take them up proactively. So, what problems am I talking about now? Next slide, Anudeep. Yeah. So, to realize that what is a tip of the iceberg, we will just do a brief activity. I would request you all to participate in this. This is for 15 seconds. We'll keep a timer for 15 seconds. And wherever you're sitting, make sure that the chair is secured against a wall or something stable so that it doesn't topple over. Okay? So the chair has to be stable. And you can hold your hands crossed over your chest and hold it like this over your shoulders and try and get up and sit down back on the chair for as many times as you can. Okay? Hope
Can we
I'm clear?
request
Make
everyone
sure.
to turn on their camera so that doctor can see you on her screen?
Yes. So make sure that your chair is stable against a wall and doesn't topple over. So you will have to get up and sit back on your chair and do it for as many times as possible in the 15 seconds that we have. Okay, so you'll have to properly get up, stand, and then sit back down. Am I clear?
Anudeep, can we
Yes.
stop sharing the screen for a few seconds so that everybody
Sure.
can watch
Yeah,
Dr. Nishmitha on what
sure.
needs to be done?
Yeah,
Yeah,
so basically, you have to hold your hands over your shoulders like this, get up completely, and then you will be sitting. Okay, we don't want half sits. Okay, so that we complete more sit-ups in that short time that we have. We have to stand up completely and then sit. Okay, and if anybody has knee issues, has giddiness problem, please don't do it now. Okay, we can do it in a more supervised way. Others who are okay with doing this can go ahead and do it. All right, Anudeep, do we have the timer set for 15 seconds?
yeah. I'll just
Okay.
start it
So,
and just mention. Yeah.
yeah,
Yeah, I'll
so
just say
let's,
3, 2, 1, start. When I say start, you can start the activity. And at 15 seconds, I'll say stop. So you can stop and just have a count till that time that how many times were you able to do it. Yeah, 3, 2, 1, start. Stop.
okay. So, great effort, everybody. So, let me just ask you, and you can type in the chat box, how many sit to stand were you able to do in this 15 seconds that we had? Okay. Yes. Madhuji is saying 7. Deepa 6. Okay. Rajan Subramaniam 8. Daisy 5. Jambunathan 5. Okay. Mini Mathan 10. Wow, 8. So we have got a very active group over here. Ravi 6, 10. Yeah, so this was a very simple test that we did, and we do it on a screening basis in our OPD, wherein it will tell us how strong we are or how at risk of frailty we are. Okay, so frailty is a condition wherein the body's mechanisms are not able to bounce back very quick. Okay, so this is one of the screening tests that we do. All of you seem to be very active here. So anything above 5 in 15 seconds is a very good score. Okay. So that means our thigh muscles are good. Our muscle mass is being maintained well into our 50s. So that is all a good sign. If it is between 3 to 5, then that means if we need to work on it a little. And if it is within 3, then definitely there's a lot of issues that are quite kind of hidden and needs to be worked at. Okay, so this was a very basic screening test for our agility. Now, I thank you everybody for participating in this. Now we will see what is it that we are looking at when we are screening for geriatric diseases, right? So the common diabetes, hypertension, and whatever diseases that we have, we obviously approach our doctors for it. But then from a geriatric perspective, what matters is the 6 M's. Now, what are these 6 M's? This is basically about memory, mood, mobility, multi-system involvement, medication, and metabolism. So these are the 6 things. Now, what are they? We'll just go about it one by one. Okay, so the first one is memory. One of the commonest things that we hear about when we start aging is that maybe our memory is away and we don't remember as well as we used to. There's usually this slower recall, misplacing things, and difficulty in doing multitasking as we used to do before. So there is always this risk of mild cognitive impairment that misses the clinical judgment most of the time. Slight things which without active screening we are not able to pick up. Right. So why it matters? Because it impacts independence, safety, and decision making in the long run. And it is better if it is addressed in the initial stages. Right. If there are some causes that can be addressed in terms of any vitamin deficiency, or if there is sometimes depression itself presents as memory loss and all those things. So we have to do assessment checks in the form of a cognitive screening, check for lifestyle and other risk factors, and see if there is something that is hampering our short-term memory into converting into long-term, whether there's been any sleep quality issues. All of these needs to be seen. And in our assessment, we usually try to focus on all of this. So the next one is the mood. Okay. So in mood, usually there is this taboo around topics like depression, anxiety, because people don't want to volunteer that they are having these issues because of certain societal stigma that is there. And even as we age, this problem becomes more and more relevant. There are certain stressors which happen in our old age, which can be in the form of an empty nest, or there might be retirement worries, certain chronic illnesses which kind of creep up, and then, it's compounded by other stressors. So, mood is one thing which will play a very important role in all the other parameters, because if we are having a good mood, we can adhere to whatever instruction the doctor is saying, or compliance to medicine, diet, nutrition, and all of these things we can be more adherent to if our mood is in a good state, right? So we have to, in the geriatric patients, we make it a point to assess for depression and see what kind of social support they are having, and point it out to them that these are the areas that will require certain improvements. Okay. Yeah. And the next one that we are seeing is mobility. Okay. As we age, we see that there is certain wear and tear that happens in the body. There can be muscle weakening, which is called sarcopenia. There is bone loss that happens. So bone loss is called osteoporosis. Together with both of the things, there is osteoarthritis that is creeping in. So these issues, if we are not addressing it in an initial stage, what it causes is a slow loss of independence. When this loss of independence happens, it kind of compounds to our mood being poor, and there are other metabolic issues we say in the form of diabetes, hypertension, those being uncontrolled. And eventually, it was kind of a cascade effect spilling over to other domains of our life as well. So, mobility is something that we want to preserve well into our 80s and 90s. And when this is not in shape, what happens is people are at an increased risk of falls. And needless to say, a simple fall can cost us years of independence. So the earlier we address sarcopenia, osteoporosis, and osteoarthritis, the better quality of life we are going to have. Okay. And in our assessment, we try to actively search whether a person is having osteoporosis, or with the certain test that we did right now in the form of functional mobility test, we see if there is some strength and balance issues. Okay. Yeah. And in the next one, we check for multi-system involvement. So this is one of the commonest problems that we experience as we age, is that there are diseases which are involving multiple systems. There is hypertension, diabetes, arthritis, slow beginning of kidney disease, dementia. So there are multiple diseases that we have to deal at once, and usually it requires you to approach different doctors for each of your complaints. And then what happens? What medicine is prescribed by one doctor is kind of contradictory or not going along with the medicine that is being prescribed by other. And we don't have a common doctor or like a geriatrician who doesn't usually hold it together. So that is where the concept is very much helpful here, that we can coordinate and give a comprehensive outlook as to how the treatment should proceed. And one of the commonest things due to this is polypharmacy. Polypharmacy is when you are on more than 5 medicines. There are certain interactive reactions that are happening between different medicines, side effects due to these interactions, and all of this needs to be brought comprehensively under one doctor, so that any adjustments can be made by the primary doctor as such. So that is why this new field of geriatrics has come, wherein the care is coordinated among the different specialties. So in our assessment, we also do this medication reconciliation, see what all medications you are on, which is necessary, which can be cut down, or there is any reduplication of medicine that is happening, and slowly try and de-prescribe this. Okay? Yes. And the last one is the metabolism. So all of these factors that I talked about contribute to slower metabolism. Okay, slower metabolism due to the age-related things, and there is weight gain, which causes abnormal distribution of body fat, and which in turn increases the risk of um, diabetes, hypertension, and all of the other issues that I just talked about. So, in our assessment, we try and see that the metabolic panel is appropriately assessed for liver enzymes, thyroid profile, and any diabetic medications if it requires fine tuning. We also do that in our assessment. So, this was a brief overlook as to the problems that are usually faced by elderly people from a medical point of view, and what we are trying to bring here in terms of an assessment which will comprehensively provide you a roadmap as to how to take care of your health better. So with this roadmap, you can go back to your initial doctor or consult any geriatrician near you and have a clear focus as to how you have to proceed. Because all our life, we spend it in earning money, okay, and we keep all our pleasures, traveling, everything for post-retirement. But by the time we reach this retirement age, it is usually health that is giving us a lot of trouble, right? And we always keep speaking that midlife is the peak of your, entire existence. But that is not the case. It is our golden years that we have a lot of experience to give to people, lot of wisdom to share. But then we also have to be in a condition wherein our body is supporting us and we are able to live a independent, functional life. So in this regard, our assessment is going to give you a roadmap or kind of a blueprint as to how you have to go about addressing your health. So I think Anudeep will be telling you more about this and we'll be open for questions at the end of the session. Okay. Thank you so much for your very patient listening. Anudeep, over to you.
Yeah. Thank you, Dr. Nishmitha. Hi, everyone. As Dr. Nishmitha mentioned, we'll be happy to take more questions, whatever you want at the end of the session. What I'll do, I'll probably spend next 5 to 10 minutes just explaining about what is it that we are trying to do at ALYVCare. So our idea is the golden years, which typically are like 60, 65 plus, 60 to 80 kind of the age, what we're talking about. We want people to stay healthy, independent, be respected, because in your golden years, the idea is that how we can make this program something which is adding a lot of value to you. The focus is that we are able to detect the problems before they happen in a preventive manner rather than being in a reactive manner. And we should be able to take some action on that. So that is the entire idea or entire mission, what we are trying to drive. The how the program works, basically there are three components or three pillars of our program. The first program is what we are we call it as a comprehensive health risk assessment. So this what we try to do, it's not focused on a particular aspect of your body. We try to cover everything, which includes like things like frailty, cognitive behaviors, comorbidities, or anything related to your body, and that's why we call it as a comprehensive health risk assessment. This is something which has started becoming more and more popular, where we try to do only a full body checkup through the blood test. But blood test is just one part of it, where we try to cover other things as well, like I told you, frailty. So there are some one test what we did today, but there are a set of 5-6 tests which we do in the frailty test to understand how well your body is performing and what is your frailty score. Same way we do for cognitive. So that is the idea of doing a CHRA, which helps you in not focusing on a particular area, but trying to highlight any problem which can happen in your body over a period of time. And that is, there are a lot of these markers which actually help you in understanding, yes, this is something where your very early signs are there on which you can start focusing on and start acting. So that is the first pillar. Second is regular monitoring. Suppose you know you have hypertension, you start obviously taking some medicine, but continuous monitoring is a very obvious thing. Same way for, say, diabetes. Blood sugar is something which you need to regularly monitor. So not only this, so we look at monitoring all your regular parameters on a very regular basis. This happens by a wearable device, which is linked to an app which we have developed, where you can see on a regular basis how your metrics are performing. The alerts will come in, things like reminders, medicine reminders, etc. All those things itself will be happening to aid your entire monitoring process. A lot of times we also want to share this with someone known, or some maybe as our kid or somebody known to us, or spouse or anybody. So those kind of things will also be there, so that not only you, they can also monitor it on a regular basis and keep taking actions wherever required. Third part is the lifestyle management. When I say lifestyle management, we all have a particular lifestyle where we are doing some activities. Like we asked how much of a activity, physical activity, do you do on a week. But everybody is different. Your body requirement might be different. You might have some issues in your legs, or you might have say overweight issues. Also, depending on that, what we do, we recommend a couple of things. Firstly, there are fitness sessions which we conduct in a group manner. So where we do a personal assessment and try to do those group classes where you can focus on those personal sessions, and require do personal sessions as well. Second is nutrition. Very customized nutrition is what we try to do. So that is the idea. Plus, aided with a regular consultation with a geriatrician, and that is how the lifestyle management thing works, wherein we try to help you to manage your well-being on a regular basis. So this is how typically our program works. What are the outcomes? These most of the outcomes what I mentioned here are done by various studies across the globe. Like the first outcome what I'm talking about is early detection of health risks has been proven to reduce the medical expenses by up to 40%. So typically, when a problem has happened and when you go to a hospital, the number of tests plus the medicines and a lot of time the procedure itself is much more in terms of cost, and you are able to save a lot of cost if you are able to detect the health risks earlier. Regular monitoring helps in reduction of the chronic disease progression. So typically, if you identify, say, a hypertension at a very early stage, you can take the preventive actions. You can work in terms of activity. You can modify your diet, which will help you in terms of managing it better and delaying the severity of the problem. So that is what typically happens, and it definitely comes down by 30 to 40%. Preventive care and wellness programs like what we are offering typically help in increasing your life expectancy, and that has been proven time and again. And we see a lot of this trend of people now in 30s, 40s, 50s also talking about running marathons, going to cults of the world, because of which the longevity of your entire activity, mobility, and the longevity definitely goes up. And this is another study what we were reading, that typically whenever you spend 1 rupee on preventive care, this actually helps in saving 5 to 10 rupees in terms of the long-term healthcare costs. That has always been the case. More you are able to spend on the right things at the right time, they actually help you in terms of reducing your medical costs. This program, I'll give a very quick brief in terms of how this program works. When I say week 0, basically this program starts with a CHRA, which is a comprehensive health risk assessment. This is a very detailed assessment, at the end of which we give you a report. Typically, this test firstly includes the diagnostic tests, which are the typically full body checkup for the blood test, plus all the frailty, cognitive tests, etc. So there is a whole list of tests which is typically done. The output of the CHRA is primarily two things. One, the medical conditions, wherever we would recommend you to go to your personal doctor or the nearby hospital and discuss with them in terms of what action needs to be taken regarding a medical problem which is happening. Second is more with respect to the lifestyle modification, wherein we come in and we help you in terms of maybe starting some regular activity on a regular basis, some kind of a nutrition plan, and that is what we typically do. So that is the output of the report. Week 1 is where we do the entire program, where we start in case you want to start with a program where you want to do fitness or nutrition, or you want to take the monitoring device, you want to use our app. So that is where we typically give the device, do the program briefing. We start with the nutrition plans. We plan your fitness sessions. We do another analysis in terms of what things we need to focus in terms of the fitness. Then in terms of daily, weekly, quarterly, there are activities daily. There are programs which are community programs, personalized diet checking, there are health reports shared with you based on the reports what we have. And quarterly, typically a geriatrician does a consultation on a quarterly basis. And we recommend after 3 months, again doing diagnostic tests to typically track the progress, that how much improvement has happened in 3 months. This is typically how in nutshell our program is. Talking about the comprehensive HRA or the geriatric assessment, typically 3,000 is what we offer it at. This includes the blood test, full body checkup at your home will be done. We take a detailed questionnaire in terms of understanding your lifestyle, what all things you do, in terms of also understanding your environment, in terms of your house, what all basic things are required, what are there, all those things. Then a mental examination in terms of mental wellness, just trying to understand that. ADL, ideal activity, daily activity assessment is done. Gait assessment, which is related to frailty, and a geriatrician consultation. This is the full program which is done. Typically 3,000 is what the cost of it is, because it includes the blood test as well. But for Silver Talkies, we have decided to give it at half of the price. So Nidhi at the end will be sharing a link with which you can actually pay the 1499 and enroll for this assessment. Post-assessment, we'll share the report with you. And there are two plans. Typically, there is a wellness plan and there's a holistic plan. Wellness plan goes without the device, wherein we start your nutrition, where we start your fitness, we start giving you health insights. we have a quarterly consultation and a community access. We have our own community where some kind of activities, etc. are done. Holistic plan comes with a wearable device, which we have imported. It's a device with a lot of things like SOS calling, maybe fault detection, medicine reminders, apart from doing the regular ECG and your even it actually does blood glucose. So all those kind of monitoring, etc. it does. Again, for Silver Talkies, people who will be enrolling at a later stage, there will be another 50% off for them. So that's a little bit of about the program. And I'll just open the floor for any kind of questions related to program or related to.
So Daisy has asked, do we come to your place or does someone come home for our blood samples? I think you briefly answered it, but maybe you can elaborate on it.
Yeah, sure. So thanks for asking that. It will happen at your doorstep. We have already tied up with two large partners. One is Orange Healthcare and one is Connect and Heal, who have a very large coverage across the country. So in most of the cases, we'll be able to do the home collection. In some cases, if the serviceability is not there in your particular location, then we come back and tell you that serviceability is not there. Obviously, the charges also change. But what we request you that from any local lab of yours or anybody who does an online pickup, at home pickup at your this thing, you can take a report and share it with us, and rest of the assessment will be done completely online. The questionnaire, etc., would be done on a call. There'll be a doctor who will first talk to you, understand details about you, post which there'll be the final call with the geriatrician, which will be happening. So everything will be happening online.
So this one, so I'm guessing since you have, partners who probably can service multiple cities, this is available in other cities other than Bangalore as well. So which are the countries where you have which are the cities where you have coverage?
So all the metro and T1, actually, I would say what 100 plus cities, more than 100 cities is what we cover actually through our partners.
So the two questions which I have are from Hyderabad and Chennai. So I'm guessing it would be available.
Yeah. Hyderabad and Chennai definitely is covered. Metros definitely no problem at all. And even the T1 cities definitely no problem. T2 and beyond, yes, there is a partial availability, but that also case to case basis, we can check in immediately.
Daisy, they are based in Bangalore. Daisy has
Yes.
also asked, what about other tests like TMT and all?
Okay, so we don't do TMT and all. That's not part of the full assessment. But at the assessment of it, we do come up with the marker points in terms of where all we need further tests or we would recommend further tests. In fact, one section is there. If anything is found out where we want a more detailed test, etc., to be done, that is where we'll recommend you to go in probably your nearby hospital or your regular hospital where you can go into. But that is not part of us. Yes, Mumbai is also there. I think somebody is asking. Mumbai also will be.
I think Dr. Himadri has raised a very important point. He said that you didn't talk about the vaccination protocol. Now, is that something that you kind of advise as part of the program? How does it work?
So vaccinations are also advised as part of the program. Dr. Nishmitha, you want to touch upon the vaccination part?
Yeah. So vaccination is definitely recommended, and usually we give it's not. See, basically, there needs to be more awareness in people about the need for vaccination, because as rigorously as we try to do it in the younger population, we need to understand that there is a slow immunity loss in elderly also. We call it due to inflammation. There is inflammation plus aging that is happening, which causes something called as immunosenescence, right? So the immunity is not all that great. And we do recommend influenza vaccines, pneumococcal vaccine, which is recommended after the age of 50 years, shingles vaccine. So it is kind of a checklist of vaccines that needs to be done. But since this is an online assessment that we do, we can only give them recommendation as to what are the vaccinations that need to take and what are the ones that need to be stressed about depending on their comorbidity setting. Okay.
So yes, we do recommend. That's a part of the report where we do.
Anudeep, how does the protocol work when somebody signs up for it? Can you kind of explain to them what happens next?
Sure. So once you sign up and once we get the confirmation that you've signed up, somebody from our team will call you and briefly explain how the program works. I cannot just now tell you how it typically happens. Post that, we will do two things. One, we will initiate the blood test pickup from your house. Second thing, one doctor will call you with in a preliminary investigation in terms of understanding how your current lifestyle is, what all typical medicines you are taking, what all problems you had in past, how independent you are, what things you are dependent on, etc. There is a very detailed discussion with typically 20 to 30, 25 to 30-minute discussion will be done with the initial doctor. Once that is done, the reports come in typically the same day or by next day. Once all those data is there, we will give it to Dr. Nishmitha. Only does the geriatric final discussion. So we share the data with her, post which she will prepare a final report and also do a final call with you in terms of explaining you what all things came out of the full assessment and also the recommendations and sharing the report. One thing I missed is the other tests, like I was talking about frailty test, cognitive test, etc. These all will be done by the doctor in the first call itself.
Yeah, Anudeep, we have a question that we were expecting. Rukmani is asking if we already have a comprehensive blood checkup done, then do we require another one?
Yeah. So we recommend that you do it now afresh. However, if you feel it's like, or you don't want to do it, and you have like a month or maximum like 30 to 45 days old report is already there, then you can share that with us. The price of the entire CHRA also becomes half of it. Instead of 3,000, we actually charge 1,500 if you already have the blood reports. So 50% applicable to you. For you, it becomes 749. Reports to 45 days is typically we are okay. If you have already done a test up to 45 days, we can take that also and do the remaining CHRA.
For now, since we are just launching this association, we are keeping it open to all. So yes, you can avail this for Anant as well. But yeah, so we will keep it for a limited period offer where it is open to your to extended family members as well, not just the club members. So everybody who's here attending the session today, because this session was open to the larger community and not just to the club members, for a limited period we will be opening it to all. And then so we'll tell you that window. And Ravi is asking any customer feedback available. Anudeep.
Yeah, so I would say we launched this entire thing, I would say nearly a month back. We have done around 40 odd assessments so far. I would say the first 15, 20 actually helped us in terms of improvising because we did try to understand what works better, what is a better way of recording all the data. And in terms of the report, initially when we sent it was slightly more detailed and more medical term kind of things is what we used to tell, which a normal customer or normal person did not know about. So yes, we have got those kind of feedback. That was the initial part. Post which last 15, 20, I can say people have been very happy in terms of the report with the specific things which have come out. Especially I can tell in terms of frailty, one gentleman actually something came out where post our recommendation he went to a doctor, an ortho, and he realized he needed a knee replacement. And that was something which actually got preventively detected during the CHRA. So yes, people have come back with the feedback that this is helpful in terms of at least understanding where all our body is right now and in which direction it is moving, where all we need to take action. Yes, that kind of positive feedback we've already.
Anudeep, would you by any chance have a sample of a report that you could show on the screen to people? Like, what does the report look like?
Yeah, sure. I'll show it. We first start with basically trying to capture what all data is there in terms of medical conditions, what all medical conditions are there. And in the discussion with the doctor, all the reported issues kind of come in terms of left hip pain, bloating, gastritis, etc. After that, these are the findings which typically come after the tests, what we have done in terms of the frailty, the gait test. Like in this case, tandem gait was impaired, one leg standing was poor, gait instability. In terms of cognitive, nothing came out, so that is not there. So those kind of things is typically what comes out in examination finding. This is the slightly more detailed thing. What we basically do, we do a health domain snapshot with all the basic things, starting from medical, functional, cognitive, psychological, nutritional, sensory, social support, medication risk, and preventive risk. We typically, on the base of the discussion and the test, we try to give you a score which gives you some sense in terms of how good or bad it is. Suppose medical is at risk. These are the typical problems: hypertension, varicose vein, vertigo, leg foot cramping. So those are the typical things. Some things are good, cognitive, perfectly stable, no cognitive complaints reported. So this is how typically the full detailed domain snapshot looks like. This is just a chart, more like an indicative of the above scorecard only. Clinical frailty assessment score, like I talked about, 3, managing well, mild symptoms. So those kind of things. This is the plan of management. Plan of management, like I was already talking, first we start with investigations or referrals. For example, we in this case we say bone mineral density Nishmitha, ESR, CRP, RFAT. So those are the kind of tests we'll suggest you. Actually, you can go and discuss with your doctor. This report also you can show and discuss with the doctor in terms of those are the investigations or referrals you need to typically do. In terms of lifestyle and preventive is when we tell what are things we would recommend, like the person was vegetarian, high protein vegetarian, plant, dietary fiber, small frequent meals, and a dietitian is where we can kind of recommend diet adjustment, physiotherapy, save home exercises, etc. required, what all monitoring is required, and some more medical medication. These are the medical recommendations where we recommend you that you talk to your family physician. These are the vaccinations somebody had asked about. In this case, these were the vaccination recommendations: influenza, pneumococcal, herpes zoster, tetanus, hepatitis B, if not taken. So those were the vaccination recommendation. We also talk about in terms of environment, in terms of a house. So fall proofing in bathroom and bedroom, non-slip footwear was advised in this particular case. So this is how typically a report.
Wonderful. Thank you for sharing that. I hope this gives a much clearer idea to everyone to what to expect. So thank you so much everyone for attending, and Anudeep, Bala, and Dr. Nishmitha, thank you for being here today and bringing this holistic offering to our members and our